So we're now going to move to thinking on the same vein. I mean, what a great segue for you, right, Kevin? This is just right. So Kevin Brigle is, as you can see here, is a nurse practitioner by training and PhD. Comes to us from Virginia Commonwealth University at the Massey Cancer Center, and he's going to talk to us about navigating our healthcare team. So.
And thank you for the invitation to speak here today. And so I'm a member of the Nurse Leadership Board for the International Myeloma Foundation. There's about 18 of us or so. And our charge is really patient education and nursing education. And we do this through programs like this and also publications. And we develop tools for patients as well to help navigate the system a little bit. And so this was actually the brainchild of Diane Moran, who's sitting over here some 15 years ago. And so it's a privilege to be part of that group. So when we talk about, again, changing the course of your care through communication, I think Yellow talked about shared decision-making, and that's what we really emphasize a lot in a lot of our programs that we give to patients. And I like to think not changing the course, but kind of like making your own map. And so, if you're going to get to point A to point B, you can use Google Maps, Waze, and good old Atlas. But what are you going to do on the way? Do you want to get there quickly? Do you want to see some things on the way? And so there's things to know. What are your goals? And what are those things that you want to do? And cancer care is a little bit the same way, and making decisions about what your treatment can be. In terms of your team, you have a team here. And it can be a really big team. If you look at the top, your primary care provider, who hopefully quickly diagnosed you with your multiple myeloma. You got your general hematology, oncology, and also some myeloma specialists then as well. You may have a radiation oncologist. And then a nice picture of me there as a nurse. So you have nursing, advanced practice nurses, clinic nurses. And again, we try to educate nurses as part of our goal in the Nurse Leadership Board to make their care for you better as well. The other healthcare staff really encompasses a lot of people. It can be supportive care, it can be pain management, psychiatry, occupational therapy, physical therapy, social work, financial people. But you've got a very, very large team, and it's important to keep everybody on the same page and to let people know your needs. And that really helps us plan your treatment with you. And again, that's this whole shared decision making that we emphasize a lot to patients. And it's really receiving information from us, but also us receiving information from you. And again, coming to an agreement. And some of the questions you can see here, I'm concerned that the treatment will impact my ability to care for my family. And what are the pros and cons of this particular treatment versus another? And so some things I'd like to talk about with my family first. And you never have to make a decision in one day. So if you've been given options, it's always appropriate to take some time and think about that. Rarely do you need to make a decision acutely. But again, this is really what kind of your goals are and the things that you need to accomplish in addition to getting treatment for your cancer. So questions, there's a lot of questions you can ask, and it's not always easy to know what those questions are when you think about it. And the IMF has these nice myeloma treatment discussion tools that you'll see on this next slide then as well. Questions and your preference as well. But these conversations, they start obviously when you're first diagnosed, they continue when you're going through treatment, and obviously it relapse as well. So if you ever have a question, bring it up. You don't have to wait for the time you're seeing Dr. Voorhees or anything like that. You can bring it up at any time. You can bring it up with the clinic nurses as well. I know they can easily get a hold of him if they can't answer the questions. And if you ever need to change treatment, again, all these questions pop up again. And your goals may change a little bit from the time of initial treatment to perhaps a relapse 3 or 4 years later. So you readdress all of those things then again. And sometimes we have changes in life priorities as well. And so what was important to us 5 years ago may not be so important at this point. And so if you change your life priorities, we think about maybe I don't want to be as aggressive with my treatment as I initially wanted to be, things like that. And sometimes it's not even your health that changes. It might be someone else. You become a caregiver and your responsibilities change as well. So here's one of the tools, and again, these are some of the questions to think about. And what are your preferences? And so for some people, that top one is important to know my treatment plans. Some people really don't care. And some people are information hounds. And so that really plays into this thing as well. And you can see one on here. It says, I want the most aggressive approach to treat my cancer, and I'm willing to endure any side effect. And some people are like that. They want to be very, very aggressive. Others are more interested in the quality of life features and continuing whatever lifestyle they're having. But when we present treatment options to you, you have to let us know those things. And so we can basically help provide treatment options based upon more of what your preferences might be. Okay, so again, tips for better communicating. Again, think about what you're going to say before you get there. Write down the questions ahead of time. Absolutely love that. There are certain patients I have, I walk in the room and they flip open their little book and we just start going through that. And sometimes they're questions or symptoms they've had, and other times there's one line on there is, I felt great. And that's really rewarding too. But it's important to know, what those things are. And sometimes you'll forget questions if you're just keeping them in your head, so writing them down is really important. Bring along a good listener, too. Very often it's a family member, it can be a patient advocate, it can be a friend. And that person will often hear things different from what you hear. If you are the patient, you hear things from a patient perspective, but a caregiver hears those same things from a caregiver perspective, so it's a little bit different. And take notes, and I have patients who record every visit that they come to. Everybody's phone is a recorder, so you can turn that thing on, you can listen. And if you do that, or if you take notes, before your next visit, go back and address those notes, or go back and listen to that last thing so that you can say, were those things addressed as we went through this time as well? And again, always take time to consider options. You're never really forced to make a quick decision. And this bottom part, so learn more about myeloma. That's why you're here today. So you get more comfortable with the conversation. The more you know about a subject, the easier it is to ask questions about that subject then as well. And they point out a little myeloma made simple. I don't know if we can make it any simpler than Dr. McHale made it there, but so that's another thing to think about. What to communicate, again, family history, and you might want to think about not just those myeloma risk factors, but what are the risk factors you might have for diabetes, hypertension, and things like that as well, which can impact what type of treatment you might get. In terms of asking questions about test results and treatments, definitely do that, especially the test results. We have seen patients who have come to us and they've never really seen their test results, and their provider will say to them, I'll let you know when to worry, but they've never actually followed the results. And so get those results and have someone explain them to you so you know the progress of how your myeloma then is doing. And again, what we talked about before, share your priorities as well. In terms of symptoms of disease, when we see, we usually ask those things, any bone pain, any this, any that. And so, again, don't ignore pain, don't self-medicate. We want to keep you out of the emergency room. The emergency room is absolutely no place to be. And so let us know what symptoms you're having. Again, not just at every visit, but if this happens between visits, we want to know that then as well. And the side effects of medications, this is really a big component of what we talk about at the Nurse Leadership Board in terms of patient education and nursing education. Because when we think about myeloma, when you're first diagnosed, myeloma has a lot of symptoms. So from bone pain, fatigue, you can get anemia, things like that, which we heard about. So a whole variety of symptoms right there. And hopefully, as we treat the patient, those symptoms go away. But unfortunately, they get replaced by symptoms from the treatment. And you can see we get myelosuppression, peripheral neuropathy, diarrhea, constipation. There can be blood clots and things like that as well. So again, there's a whole variety of side effects that we can cause, even though we're helping patients feel a little better. And a couple of snippets here, some things we commonly talk about with patients, GI distress. And so a lot of patients end up with either constipation or diarrhea from their treatment. It's pretty common, but again, it can be caused by the treatment. It can also be caused by some other things you might be taking, laxatives, over-the-counter medications, antibiotics, and things like that. So it's always good to know what medications you're taking, especially the over-the-counter ones that we may not make it onto your med list. And so what would we say to do? Well, obviously we check your med list, but obviously increase your fluid intake. There's antidiarrheal medications, both over-the-counter and also prescription ones as well, if we can do that. Increase fiber, but all these things that we can do to manage something like diarrhea. The big three right here, the triad, fatigue, anxiety, depression, those very often kind of come together. And if we can manage one, very often it helps the others as well. A lot of causes for the fatigue, anxiety, depression, obviously the physical ones of going through treatment and having the myeloma, but end-of-life concerns, change in social status, family status, and things like that then as well. And certainly finances can be a really, really big thing these days. And I think I finish up on a slide with finances. Management, there's a lot of different things we can do. When patients come in and tell me they're fatigued, I always tell them there's not one thing I can do to have you, you'll come out of here and you won't be fatigued anymore, because it's usually kind of multifactorial, but let's work on something. And again, if you have a good supportive care clinic where you go, they can help manage these things then as well. All right, financial burden, big one these days. And we were talking earlier down here at this table that the health system in the United States is broken. And it can be very, very expensive to have cancer care. So from the medical costs, the premiums, the co-payments, the travel expenses, just getting back and forth. And, some of our treatments are weekly, back and forth. So medical supplies. The big one these days are obviously prescription costs. And we talked about some of these other drugs like Revlimid. It's very, very expensive, complicated, and can you get the drug? And so there are PAP programs. There are foundations and things like that, which are, the money's getting a little bit harder to come across. And as was pointed out, it can take a little bit of time to actually, you have to put in some time to get those drugs at a good cost for patients then as well. And of course, the loss of income, not just from the patient who's getting treated, but from the caregiver as well, who may have to bring the patient to and from treatments. So again, I think, I know we're gonna hear from down here at Levine, a good group of people, from financial people, nurse navigators, social workers, all hopefully part of a healthcare system that you can address. We have all those people as well. They all do similar things, but different things, and they all know what they can do. So enlist the help of those people as well to try and take care of some of those problems. And this slide you've seen a couple of times up here, at least the information on here. So there's a lot of things online that you can go to, find a local support group. I think there's like 8 support groups in North Carolina. We've got 4 in Virginia and a couple more if you count the DC area up there as well. But the support groups are great as well. If you're not into support groups or not really online savvy, again, that info helpline is there as well. All right, so in summary, you can and should be part of the decisions of your health care. So give yourself permission to speak up. We want you to speak up. We want to know what your goals, your plans are. Anything you got planned in the near future, we need to worry about as well. And so again, you can change your course, but I might say more or less, you can plot your own course. And there's no right course, there's no wrong course. There's a lot of different things we can do, and you're not stuck in one pathway. There are U-turns, roundabouts, all that kind of things, detours, but you can get back, and so a lot of good options. So again, let things be known.